Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Good afternoon. So what we're going to do is we're going to have a look today at the skull and then the cranial nerves. So having a look here, we can see the skull, and what you can notice is that there are two different parts. We have this anterior part and then this more posterior part. So we call this the facial region and this the cranial region. So what this means is then that we've got two different types of bones which make up the skull, and those are then the facial bones and the cranial bones. Some of the distinct differences that you can see between these bones is that what we describe the cranial ones to be is flat. So we talked about flat bones in the past. So we've talked about bones like the scapula or the ribs and the ilium as an example. And here now we have the skull. So the cranial bones, why are they described as flat? Is because just the same, the cranial bones have borders, and you can see that these borders junction with the other cranial bones and make joints, therefore to make the rigid skull. From there, what we can see is that there are two surfaces, an outer surface of the skull or an outer table, and an inner surface of the skull or an inner table. And in between that we have some spongy bone. Now that's therefore defining our flat bone, two surfaces and borders. What you can see on the inside here are that there are also some impressions, and these impressions, like little rivers, are for the blood vessels that run on the inside around the brain. On the outside, we can distinctly see lines on the skull, like on this picture here that you can see coming around here, where we would have attachment of muscles. And so therefore the inner side will obviously take the brain, so this is our cranial fossa, and then the outside would be for attachment of the skin and the muscles. So when we're talking about the skull itself, there's some other features that exist inside the cranial bones which make it quite interesting. Now, one thing that we can see is that the underside, if we have a look at this, we can see that there are many holes or openings. So these foramina, they exist to allow structures in and out of the skull. So many of these foramina are for the nerves which leave the brain to come out. An example, this big one here is for the artery to go in. So our internal carotid artery would go in this big hole here to then go in and supply the brain. This big hole at the back is called foramen magnum because it's the largest of them all. And what would go in here would be some vertebral arteries, and then obviously what would come out of here would be the brain stem and the spinal cord to then travel down the vertebral column. On the outside we can see some big rough features here and then some other smooth features, and these are to do with muscular attachment, right? As an example here, we can see another opening in the side of the skull, and this is for sound to be travelled in so that you can hear. Our facial bones, these ones we can describe as flat. So an example, the zygomatic bone here is a flat bone. But then the mandible and the maxilla are irregular bones. So we have two different types of bones, flat ones and irregular ones in general. Now these bones join together by a very special bony joint that we call a suture. So having a look at this skull here, what we can see is that these junctions have got these little islands. Now the word suture, S-U-T-R-E, is to describe like a stitch. Alright, so what you can see here is if you had a cut and you got some stitches, you might have some lines which are a bit wobbly like this, and these sutural joints are what join your facial and your cranial bones together. There is one joint in the skull which is mobile, and that is the one between the temporal bone here and the mandible. So we call this the temporomandibular joint. This joint is a synovial joint and is like a hinge joint, as an example. So it will open the mouth and it will close the mouth. There are some other actions that will also occur here at your temporomandibular joint. This would be for the jaw to slide forwards and to slide back, which we'd then call protraction and retraction, just the same as we did when we were talking about the scapula. Some of the other features inside the skull would be that inside your nose you have these special bones which are like wings. They direct the air through the nasal cavity and cause turbulence. They cause it to stay in there for a longer period of time so that it warms and humidifies the air. Inside your facial bones as well, you then have pockets, and these pockets are called sinuses. So what we can see that in the prac book here is that we have a question that says, which bones contain the sinuses? And the bones which would contain a sinus would be the frontal one, here this blue one. Then you've got the ethmoid, which is in the inside of the eye here, which is this grey coloured bone just tucked in behind the orange one. This big green one on the front, or the teal coloured one on the front, is the maxilla. This also contains a sinus. And then the yellow bone here contains one too, which we call the sphenoid. Now the function of these sinuses is to reduce the weight of the skull. So think of a bird, it has hollow bones, it makes it lighter. It's also there to resonate your voice. So what I want you to do is hold your nose and say a few different words and see if it sounds different. You should find that it does, and that's because the air isn't being allowed to pass through your nasal cavity in the same way. It also then acts as a little storage space for some air to keep the air that you breathe in mixing with the warm air that's inside, and therefore it warms and humidifies the air as it comes in. So they're the three functions of our sinuses. And so once again, the bones that exist inside the skull which have your sinuses would be your frontal, your ethmoid, E-T-H-M-O-I-D, your maxilla, and your sphenoid, S-P-H-E-N-O-I-D. So these are those bones. So if we have a go at labelling some of these bones here, what we can see is that they're always going to be colour coded, which is nice. So this big one at the front here in blue, we call this the frontal bone. So please don't confuse this with the word lobe. Frontal lobe, this is to describe the feature of the brain. So this would be the frontal lobe, and what you can imagine is that would come in here inside the skull and be covered by the frontal bone. This green one here we then call parietal. The purple one at the back, occipital. Then all of this pink one here is called the temporal. So what we've got here is we've got the main bones which are going to be making up our cranium. The sphenoid here is then another bone which makes up your cranium. So if we have a look on the inside of the skull, it will give us a better appreciation of where these bones are relative to one another. So I'm only ever going to ask you a question about the outside, never the inside in this course, but just so that we can get a bit of understanding. So here, if we look at the inside, it's going to look very different when compared to the outside. So turning it this way so we can orientate ourselves, anterior this way, posterior this way. So holding it like this, what we're actually looking at is the frontal bone here is this space up here. Then where the sphenoid would be is this pocket, or this fossa here, alright? This large ridge here that we can see is a part of the temporal bone. So inside there will be where your ear is and the cochlea is for sound. The big hole at the bottom, like we said, would exist through here, and that would be directly just about here. So which is a combination of the occipital and sphenoid bones anteriorly. So here, this is occipital, and this one then is also sphenoid. So these two big wing parts, and then this part coming up here like this. Now, if we're going to name some of the joints between these bones, what we can see here is that this suture is in a plane. Right? So we've talked about our planes and directions before in the past, and we can see the suture, that wobbly, squiggly joint. So we call this one the coronal suture. So if you were going to point to this on your head, you pretty much just put on a crown. Right? So pretend that you're a prince or a princess or something like this, and then take your fingers across the top of your head. This is showing you where the coronal suture would be. This one coming down between the parietal and the occipital bones, if we look at it from the back of the skull, what we can actually see here is that it looks like an upside down Y shape. So if we think about our Greek letters that we've talked about, so we've spoken about deltoid before being triangle shape, then upside down Y is actually the letter lambda. So what we call this one the lambdoid suture, because it looks like an upside down Y. Now, between these two, you can see that the two parietal bones are also connected by a suture. And what plane is that running in? So if it's running front to back, along between these two bones, we would call it the sagittal suture. Now, whilst we can't see it in this picture, we can imagine that it would be separating the two parietal bones. There is a special one that you can then see at the front here, whereby if we join frontal sphenoid, parietal sphenoid, temporal with the parietal and temporal with the sphenoid, we get an H shape. Do you see that? How it kind of looks like the letter H that you can see there? So this special one here, so the H-shaped suture, we call the pterion. Now the word pterion, P-T-E-R-I-O-N, comes from a word which means wing. So if you've heard of pterodactyl before, that's a winged dinosaur. So pterion is the wing. And we said before that on the inside here, we've got the wing of the sphenoid, and you can see just up here where that joins on the inside relates to the part on the outside. So the pterion is the junction between the sphenoid wing and then the other bones. Now this region here, because it's only a small amount of contact, it means that you have an increased weakness at this point. So if the head was to be knocked at this point here, then there can be some possible damage to that joint. And what's bad about that is that there's a big artery on the inside we call our meningeal artery. So if that was to be damaged, then you would have bleeding inside the skull, which we don't want. Now on the temporal bone, here if we look at this one, this suture coming around like this is between the smooth part of the temporal bone and the parietal bone. So we call this squamous suture because it's from the smooth part. This large bony prominence here is called the mastoid process of the temporal bone. And we have a big neck muscle that we'll talk about in the next coming weeks, which attaches here. This hole then that you see here, this is called the external auditory or external acoustic meatus. So a meatus is kind of like the hole in either end of a cylinder. So what we would expect to be going in here would be sound. So sound travels into the external auditory meatus to go towards the cochlea so that we could hear. This bone then, your lower jaw, which you can see is holding your lower teeth, is called your mandible. Now this is a single bone, alright, which joins both sides. Then the one which has the upper teeth is the maxilla. Now the maxilla is actually two separate bones which come together during your development, alright, to then create both sides of the nose. Now you can see in this one that the maxilla makes the roof of your mouth, right, whereby here we have the palatine portion of the maxilla. Then you can also see that it makes the lateral part of the nose and the inferior part of the eye socket too. So your maxilla is a really big bone and it actually contains the skull's largest sinus. This orange one here, which we can outline roughly, we call this the zygomatic, which is effectively your cheekbones. The little orange one to the front is the nasal bone. This pink one here we call lacrimal. And what is lacrimal, if we talk about some other features, would be tears. So here there's a small lacrimal duct where your tears go from the gland down into your nose. That's why you sniff when you cry. And lastly, just that little one tucked behind is the ethmoid. So what I want you to do here then is put a little star on the bones which have a sinus. So we have the ethmoidal sinus, we have the frontal sinus, we have the sphenoid sinus, and we have the maxillary sinus. So do you see that those four bones there which contain a sinus, they are closely related with the nose, and so therefore we can see that the function of our sinus would be communication with the nasal cavity, and therefore warming and humidifying the air also. From there, what we can then also say is that the frontal bone, the parietal bone, the temporal bone, and the sphenoid bone, they are the ones which once again make the pterion. So these are some important things to remember. Which bones contain a sinus and which bones form the pterion. Alright, we'll speak again soon when we talk about the cranial nerves.